There are now 13 deaths at a Billings long-term care facility, the deadliest COVID-19 outbreak in Montana. Just yesterday, employees with Kolsch Communities, the company that owns Canyon Creek, traveled to Billings from Washington State for what they called a day focused on residents and employees. County health officials say the latest victim, a woman in her 90s, passed away at Canyon Creek yesterday. It's the 13th death in the last 15 days tied to that outbreak at the facility. Yellowstone County Health Officer John Felton says he's running out of words and says, quote, "For those who still doubt the reality of COVID-19 and its impact on all of us, I encourage you to wear your mask and wash your hands." Well, tonight, for the first time, we're hearing from leaders of Canyon Creek Memory Care Facility. The outbreak there happened after the facility refused voluntary testing from the state of Montana. As our Andrea Lutz reports, officials with Canyon Creek say those voluntary tests would only have provided a snapshot of results for a small moment in time.
Traveling to Billings from Washington State for the first time since COVID-19 appeared in their facility, leaders of Kolsch Communities say their primary focus is on residents and staff.
It's been a busy time and they come first. We have to make sure that we're taking care of them.
Chief Operating Officer Eva Arendt says that's why officials haven't addressed questions publicly yet regarding why voluntary testing was initially refused.
So we opted out, as did, I believe, 100 other communities in the state of Montana.
Kolsch, a family-owned business out of Olympia, Washington, operates over 30 facilities in 8 states. During a Zoom call the day after leaders, including the company's CEO, left Billings, they say they stand by their decision to opt out, but did promptly take measures to ensure there was no cross-contamination when the virus was initially discovered.
All it would do is give us a picture of those results for that moment in time. Residents could be exposed or staff could be exposed the very next day and test positive later in the week.
But Arendt says they want the public to know administering a COVID test to a dementia patient is complex.
The deep nasal swab test is invasive, and to a person who does not understand what is happening, it can be very scary for them.
The outbreak started with a resident who tested positive at the hospital on June 30th. The state offered its free testing in mid-June.
We have put in place policies and procedures that we feel have protected our residents well. I mean, it is June 30th when Canyon Creek had their unfortunate outbreak. And though we've been in the throes of a pandemic since late February.
Currently, 43 of its residents have tested positive with COVID-19. 2 are currently negative, while a dozen have died. Reporting in Billings, Andrea Lutz, MTN News.
And that number is now up to 13. And we do want to point out there is currently no federal testing requirements, and the rules apply differently in every state. Those with Canyon Creek say more testing is happening now, with one round already finished and another round of COVID testing on the way.